right, so right now we get to speak with Dr. John Amwesi. He's with KCCR, and they have been monitoring the figures, and they have a first-hand information as far as the surging cases are concerned. Thank you very much, Dr. John Amwesi, for making time to speak with us. Now, I'm sure you've also noticed that the cases are surging, and I'm sure you're equally worried. I'm sure KCCR also has a fair idea what the figures are, and I'm sure you'd have pretty current figures. What are the figures telling you?
Well, Israel, good evening to you and to everyone listening. With regard to the figures, really, as you know, for all the testing centers, they transmit these numbers to the Ghana Health Service, and then these put up on the dynamic dashboard, which you see. So I wouldn't have any figures that are different from what the Ghana Health Service has up there. But one thing I want to make really clear, and I've done this over and over again, is that the numbers that you see on the Ghana Health Service dashboard will always be epidemiologically what we call the tip of the iceberg, or the ears of the hippo. What that means is that the figures that you get from people reporting in hospital are only a minute representation of the reality that is going on in society at two different levels. One is the fact that it is only people who are sick or think they're unwell who report to facilities and therefore get tested. All right. It is not all of those who are sick who will even get tested. So ultimately, the numbers that you get showing up there will never be a true representation of what's happening in society unless you have put in place sentinel sites where you are routinely measuring in a consistent way, in a representative way, what the rate of spread is. And this is something that I've been calling for over 1 year plus, so that we can have a real feel of how things are going. And then it actually helps you to predict ahead of time as to how things might look like in the future. We've heard of countries already that are predicting when a peak will be. Currently, Indonesia is the epicenter for Southeast Asia for COVID right now, and they're already predicting when their peak will be. But we are in a third wave. It would be nice for us to be able to tell when we might peak. I don't think we can do so right now with the kind of figures we have.
All right, so we've been speaking with Professor Wandari of WACBIP, and he says he has no doubt that looking at what is happening right now, he believes that we're in a third wave. Would you agree that we are in a third wave?
Well, Israel, if you remember, 3 weeks ago, I did say we are in the beginning of a third wave. So right. I think I'll be surprised if anybody suggests that we are not in a third wave. I wonder what country they'll be in. So definitely we are in a third wave. What I'm concerned about is us being able to tell when we might peak, and that could help us to plan certain things. I think that's a really critical thing if we're able to do, how it's going to move forward. All
right. So I'll be coming to you shortly for you to give us some ideas as to what you think we should be doing under the current circumstances. Well, apart from trying to figure out where the peak is going to be. But I've also been joined by Dr. Godfrey Techi. He's with UGMC, and hopefully he's able to give us a better picture of what exactly is happening in the hospitals. Thank you very much, Dr. Godfrey Techi. Now, can you tell us what is happening in the hospitals right now?
Israel, some time ago, we were not getting any COVID cases in our emergency department. But over the past 2 to 3 weeks, when patients come into the emergency department with normal illness or complaints, and as part of our workout, we test them for COVID, we are getting about 25–30% of our patients at the emergency department turning out to be positive, which is very scary.
All right, so Dr. Techi, so essentially you're saying that these people didn't come in with COVID symptoms.
Yes, please, Israel. They didn't come in saying, I have COVID, I've come for treatment. They just come in either with signs suggestive of heart failure, or they've come in complaining of some abdominal pain or some palpitations, or for their normal complications of their illness, high sugars and diabetes. And as part of the workup, when we know we are not in ordinary times, when we test them, about 25–30% of them comes out being positive.
All right. Now, what are some of the observations you've made as far as these patients are concerned?
I wanted to talk about the changes on the lungs as we pick from the chest CT scan we do.
All right.
Israel, if you could help me show the images as I'm speaking from my phone. If you could show some of the images I shared with you so I could talk or speak to the images.
All right, so we have some of the images we're going to be showing on the screen right about now. You indicate that the images you sent to me earlier showed those with mild cases and those with severe cases and the normal cases. So if we could have those on the screen right now, and then Dr. Godfrey Tichi would speak with it. But yes, we also have joining us already. Okay, so we have the first image. And this shows the normal CT scan, or the CT scan of a normal person.
Yes, Israel, you are right. So I want viewers, maybe unfortunately those who are listening to us and not watching could not appreciate this. But if you look at this CT scan, it shows how a normal lung appears on a chest CT scan.
All right.
So you can see the black areas, the little white areas showing the vessels and all that. Right. This is what we call a normal lung CT scan.
What do you want us to show you next?
The other categorization of the illness.
All right, so we have the mild on the screen now.
Yes, so on this view, there's a patchy, what the term we use medically is ground glass appearance. There's some patchy opacity near on the, depending on how you look on the screen. For me, I know it's on the left side, but for viewers, it may appear like it's on their right side. There's a patchy opacity there. So that's how, this is what we call mild. So someone with a mild COVID disease will have such a chest CT scan.
Okay, so the non-black area on the screen for the what should have been the normal lung, you're saying that the non-black area is an infected area.
Yes, there is a ground glass area which is suggestive, highly suggestive of COVID.
All right.
And when you correlate with the test, then it is COVID.
All right. So let's move to the next image.
So the next slide, this is also a type of mild disease. You see, let me say this. You can have two people having mild COVID-19 disease, but they may have different chest CT scan findings.
All right.
If you look at this one has more of the ground glass than the first one, but it still qualifies as a mild disease.
All right.
Because when you look on the right side, it's just at the apex area and a little on the left side towards the lower side. Just that too. So if we could proceed to the moderate disease film.
Okay, so we move to the next image. And this is the moderate.
Yes, Israel, this is the moderate disease. You can see the natural black area that you should see compared to the previous one, which was considered normal. This area is now being replaced by this, what you see here as white opacities.
All right.
That means that the lung is getting destroyed. And if your lung gets destroyed, you cannot breathe properly.
And if you cannot breathe properly,
shortness of breath as part of the severity of the illness.
And if you cannot breathe properly?
If you cannot breathe properly, then you have to be rushed to the hospital. And we all know what proceeds from there.
All right, so we're moving to the severe.
Yes. You can see now, majority part or most part of the lung is consumed by the disease. When we finish, I'll give a little explanation to why this is a very serious thing that all Ghanaians should take it very serious. This is severe disease. These are the people who will need some form of critical care or high dependency care area. These are the people who are battling for ventilators or non-invasive positive pressure ventilation.
Which we don't have enough of.
These are the people who need critical care or some form of care in the ICU. And we don't have enough of this equipment in the country. So the reason why I'm drumming home a point on these images is that it's a serious disease and people think it's a joke. When you look at this lung, I don't know how many people watching us want to have such lungs. And you can't look at somebody's face and say that, oh, when you have COVID, your lung will be mild. You can't predict. So we all have to get very serious.
All right.
Israel, let's move on to the next slides.
Right, so we're on the final slide.
Yes, there's a one before this one. This is also a form of severe COVID-19.
All right, so let's go
to the critical one.
So this is the critical.
Yes. Most people with critical don't make it. Some people of the severe will make it, some will not make it. And those of severe who survive, who are able to go home to their family, they have limited volume of lung. So the next COVID-19 infection or another disease that will take away the lung, then they are gone. And this is infecting young people. Let's not kid ourselves, Israel. COVID-19 is not a disease for old people. It's affecting young, healthy adults. So we have to be very, very careful. Now, let me explain something before I go to the other point. Israel, see, in the lung, the unit entity of the lung, like the cell, the lowest level of the lung is your cell. So in this case, I'm talking about alveoli, the smallest unit of the lung, which takes place in gaseous exchange, where it gives oxygen to the body and takes carbon dioxide out, and we exhale or we breathe out.
Yeah.
If you have these lung changes, you have now increased the space between these gaseous exchange surfaces. So it's like you are in abundance of water, but you are thirsty, as Bob Marley says. In this case, we can give you all the oxygen in the world.
Dr. Godfrey Techi, look, Dr. Godfrey Techi, yes. I think we need to have some more time to delve into this a lot more. But right now, we do not have, unfortunately, we do not have enough time to go into that. But thank you very much. I want us to go to Ohiming, who is in the Ashanti region, and he apparently has the very latest cases as far as COVID-19 is concerned. Ohiming, what can you tell us?
Yes, Israel, in the Ashanti region, out of 43 districts, 25 have recorded new cases in the region. We are talking about a period between 12th and 18th July. And within this period under review, 491 new cases were recorded in 25 districts out of 43 districts. As it stands now, the region has recorded 260 deaths. 260 deaths.
Well, that's cumulatively since the pandemic, right?
Yes, since the pandemic.
How many active cases are we looking at right now as of the July 18 date?
Right now, Ashanti region has 840 active cases, and out of the 840, 814 are being catered for at home, and we have 26 in treatment centers with 9 severe cases, 7 moderate cases, 6 mild cases, and then 4 critical cases. Let me also add that in the last few months, since March, when the new variant, being the Delta variant and the rest broke out, Confirmation Teaching Hospital has recorded 26 deaths since March this year alone.
All right.
Israel.
Thank you very much, Ohiming, for those stats. I want to go to John Amwesi. Dr. John Amwesi, can you in a minute tell us what exactly we should do? Just a minute.
Well, Israel, thank you very much. I think it's exciting what Dr. Godfrey and others are sharing, because it really gets to the crux of the matter and tells you the kind of dire situation we're in right now. For now, unfortunately, I do not have any better news apart from what we've always been saying about the mask wearing, the hand washing, social distancing the best we can, because the only saving grace is the vaccine, which we do not have right now. We're hoping that some is going to come in end of the month, maybe next month at some point, towards the end of next month, maybe a much larger consignment. But till the vaccines come, we have nothing else to do. And this is why we are very concerned. I know that my brothers and sisters in the hospitals, we're also concerned about how this is going. And you remember when I came on, I talked about us being able to predict when we might peak at this rate.
Yes.
I think it'll be very useful for us to have an idea of how bad this might just get before it gets better. But for now, hand washing, mask wearing, social distancing, and all the usual stuff, that's about all we can do.
All right. Thank you very much, Dr. John Amwesi of KCCR. You're watching Joy News Prime.